How do cultural differences impact informed consent globally? Imagine walking into a clinic in a different country and feeling unsure if you truly understand what's being explained. Cultural differences play a big role in how patients give consent for medical procedures, including plastic surgery. These differences shape how information is shared, received, and understood, making it essential for healthcare providers to adapt their approach. Different cultures have unique beauty standards and reasons for choosing surgery. For example, in some Asian cultures, patients may prefer subtle changes that keep their ethnic identity intact, while in Western countries, patients might seek more dramatic transformations. Recognizing these goals helps surgeons explain risks and benefits in a way that matches what patients value most. Communication styles also vary widely. In some cultures, patients might feel uncomfortable questioning a doctor or might see the doctor as the ultimate authority. This can make it harder to ensure they truly understand the procedure and its risks. Language barriers add another layer of complexity, so using translators or culturally appropriate consent forms becomes very important. Clear, simple explanations help patients feel confident and informed. The idea of personal autonomy, or making decisions alone, is viewed differently around the world. In some cultures, family members or community leaders are involved in health decisions. Surgeons need to respect these cultural norms but also ensure the patient's wishes are heard and that consent is voluntary. Balancing respect for cultural practices with ethical standards is key to ethical practice. Religious beliefs and ethical values influence how patients view surgery. Some may have concerns about bodily integrity or specific procedures based on their faith. It's important for consent discussions to be sensitive to these beliefs, ensuring patients feel respected and fully informed. Legal requirements for consent also differ. Some countries relying on detailed written forms, while others may depend more on oral agreements. These differences are shaped by cultural and legal norms, and understanding them helps protect both patients and providers. When healthcare providers ignore cultural differences, misunderstandings can happen. Patients might feel dissatisfied or even experience increased risks if they don't fully understand what's involved. That's why cultural competence is so important. It helps surgeons communicate better, build trust, and improve safety. Practical steps include creating consent forms that reflected local languages and values, training surgeons in cultural awareness, involving family when appropriate, and providing information in ways that match patients' literacy levels. Respecting patients' aesthetic goals that align with their cultural identity is also vital. In the end, respecting cultural differences in informed consent isn't just about following rules. It's about making sure every patient can make a truly informed, voluntary decision that respects who they are and what they value. This approach builds trust, enhances safety, and upholds the rights of patients everywhere. Always remember, personalized care and cultural sensitivity are the foundations of ethical medical practice in a diverse world.